So in this video, I want to discuss the structures of the reproductive system seen in both the male and female. And first, we're looking at the male, since that's how your textbook goes. We'll use that order. And of course, it is evident this is male by the presence of the penis and the scrotum and testicles. We'll begin ourselves first with the scrotum. On the outside, you will find the scrotal skin. Note the wrinkled texture, and the wrinkled texture is caused by a muscle called the cremaster muscle, which I'll show you later. We have the testes, one of the testes here, and it is covered by a layer of tissue here called the tunica vaginalis, which gives us this white texture. And on top of this is the epidermis on top. And then we come up to the vas deferens, or the ductus deferens, or ductus deferens or vas deferens. You will see the gonadal arteries, gonadal vein, or the testicular arteries coming in, and going up again are ductus deferens. On this portion, to see the rest of the things, we need to open this model up and discuss here. You can see the cremaster muscle surrounding the testicle here, as we can look at some of the layers of the testes. And this is what is responsible for also contracting and constricting the testicle scrotum closer to the body wall and to maintaining body temperature. So we want to discuss that fairly deep as we run through. Now, secondly, as you're coming through, we want to discuss the penis. Now, on this one, you will know that on this side, the penis is circumcised, and we have the glands exposed. Now, if you're looking in other images, you will see that the prepuce, seen here, is left on the deeper side, the prepuce, which gives the difference to the uncircumcised male penis. Now, for everything else that we look at in this section, more superficially, we'll note that this material runs, the ductus deferens runs up. Here is the bladder. Here is the prostate, seen superficially. Let's remove this as I discuss the prostate, as we come through the prostate down through to the deeper tissues of the penis. And here you will find the corpus sponginosum, which is used in achieving and maintaining erections, and the corpus cavernosa, the tissue inside the penis. Also, you will see the blood vessels here in cross section. Also, the elastic ligaments associated with the penis in keeping it straight. Now, the few things you cannot see, the urethral glands, which secrete buffers into the ejaculate that's used, but we can see on this model also, we can't see all the structures that are used to produce. Now, you can see a little bit of seminal vesicles here. If I place this model away and look at it here and zoom in a little bit, we can see the ureter, we can see the ampulla here, the vas deferens where sperm is stored, and the seminal vesicles here. You will also see this on the models for the urinary system, or we call the kidney on a stick. And if I remove the bladder from this model, it becomes fairly evident, and it is a little bit better to discuss the seminal vesicles and the ductus deferens or vas deferens with its ampulla here, and again the prostate here. So those structures become fairly evident. So the last few things we want to discuss coming from here is the various urethra for the male. As we come down, the urethra will come down, and we hit into the prostate, become the prostratic urethra. We hit through here, this membranous diaphragm, become the membranous urethra. through urethra, all the way to the penile urethra, and out the external urethral meatus. So these structures here in the male, and again you will note the urinary bladder is rugate, as we can see, and the detrusor muscle in this torso, in this model. And it does a good job of showing the urinary system in some detail, and all the portions of the male reproductive system. Now, everything else you've seen is, that's really everything we discussed. I want to move now to the female reproductive system. We'll zoom out as far as we can get as we look at this model. And the female model, we have a few structures we want to discuss externally surrounding the vagina. You have two volar folds. The one most external is the labia majora. The one more internal is the labia minus, which will only lead here to the vagina, that will continue on into the uterus, and we'll discuss that first before we discuss the major portions there. As we come in through the labia majora, labia minus, we enter into the vagina, and here you will note a rough texture called the rugate, which allows expansion of the vaginal walls as we go through for childbirth. So it can expand, but of course only so much. We come up into here to find the cervix. We can find an opening called the, there's a few names for it, the cervical os, that you will see in one portion here, the cervical os here. And this part of the cervix above it is referred to as the fornix. You have a urethra. Inside lining it is the endometrium, the muscular layer, the myometrium, and we have the parametrium here on the outside, the parametrium on the outside, forming the uterus. So endometrium, myometrium, and parametrium, all these together, especially the myometrium for the contractions we note during childbirth. Now, on the uterus itself, if I remove this, you will note that there are gonads that are descending off of this. Let's orient ourselves. Here we have the external anal sphincter, the vagina here. So we find ourselves here first with the ovary. The ovaries. And the ovaries are going to go through the fallopian tubes. Now, through the fallopian tubes, you have the fimbriae, these feather-like projections that come off on the ovary, the fimbriae. And they continue on into this tube, goes on into the uterus. And the uterus is covered here by the broad ligament, which is a peritoneal-like attachment. Other peritoneal attachments also we will find, if we're looking straight down on it, is this one right here, the ovarian ligament, which sometimes causes discomfort in childbirth. We can zoom out and focus a little bit better and find the ovarian ligament. And as well, we found a few other things, broad ligament controlling, covering that, our ovary, our fimbriae, our tubes here, the ovarian tubes or the fallopian tubes coming in, and the structures that we would discuss. The cervical os, the cervix, and a little bit of what we can see of the vagina here. So generally that is all the major structures visible on your models that you can see. Remind yourselves that you cannot see everything, but I hope you find this stuff helpful. And this will conclude the video discussing the reproductive system that will be seen on the exam. And this should be the last material that you will cover in AP2 lab. And this concludes my video.